staying with us on Channels Television as I warmly welcome you to Health Matters. I am Yomi Otaigbe. Today on the show, we'll be delving into an aspect of hematology field, looking particularly at a condition known as anemia. Who and who can be susceptible to being anemic? What are those symptoms of anemia you should never ignore? And how can it be prevented and managed? These and other questions will be answered by our guests on the show. So stay with us. We'll be right back. Joining me now to shed more light on what anemia is a consultant clinical hematologist with the Lagos State University Teaching Hospital, LASOTH, Dr. Wole Banjoko. Thank you so much, Doctor, for being here with us.
Thank you for having me.
Okay, let me start by sharing my experience with anemia. So it was when I was pregnant with my first child, and I didn't understand it. Most of the time, I'm just feeling dizzy. If I stand up, I'm already like blacking out, and I never understood it until, of course, I had to go to the hospital, and they checked my blood, and they said it was so low. I was, okay, what happened? Why will anemia happen? Let me ask you that first question.
Okay, so I'll say that the way we approach anemia is in two ways. One is a clinical approach, and I'll explain that, and the other one is kind of like a laboratory approach. The clinical approach is looking at it from the point of whether you're producing enough blood. So we know that the bone marrow is where the blood is produced. So if you're producing enough blood in the bone marrow, it's good. But if you're not producing enough, it means you're going to become anemic. And I'm going to define anemia now. The second one is if your blood is being destroyed. So if you're producing enough blood, but unfortunately something is happening within your body due to some circumstances which we'll discuss, and then your blood is being destroyed, and there are symptoms that show for that as well. Then the third one is if you are losing blood. So if you're losing blood, that's another thing. Imagine if you're producing enough blood, your blood is not being destroyed, but something is just happening whereby you're losing blood. Occurs especially more commonly in women during their menstrual periods. So women lose blood to different levels during the menstrual period.
So for my own case that I just mentioned, in the past,
yes,
I was just fine just before pregnancy.
Yes.
So did pregnancy induce my anemia?
When you say you were fine, first of all, we're not sure of that, because pregnancy might have tipped you more into it. You might have been on the borderline. And then when you got pregnant for other reasons, because the baby is now demanding more. So he's taking more of your blood, and maybe you had just about enough. Then at that point in time, you start manifesting some symptoms. That's how it goes.
So let's break it down. You said clinically and
laboratory. Yes.
And then there are, is the person making enough blood? That's a question.
That's one question.
And then the other one is the blood that is being made being destroyed by something else? Yes. Let's start with, is the person making enough blood?
Okay. So blood is produced in the bone marrow. And the bone marrow needs particular, I'll call them fuel, something to use to make blood. And there are three major things the bone marrow needs. One is iron, second one is B12, and the third is folic acid. So if you give these three fuels to the body will be able to produce blood if the environment itself is working. So the other thing that you have to look at is the bone marrow environment itself. Is it in a healthy state? Once it's in a healthy state, then it has the nutrients it needs, then it should be able to produce blood. There are things that can, apart from that, suppress the bone marrow from producing it, even though it has nutrients. But things that can occur due to some healthy states that are not good, it can suppress the bone marrow from producing. So things like infections, after a while, can suppress the bone marrow from producing and things like that.
Okay.
Yeah.
So that's for production of blood in the bone marrow.
Yes.
So if everything is fine and the person is producing this blood, but something else is happening underground, what could that be?
Yeah, so if we leave that, because if he has enough nutrients, he's taking enough B12, he has enough iron, he has enough folic acid or folate, and the environment is good, we would, okay, look for the next thing, which we said is he breaking down cells? So the things that can cause him to break down cells rapidly, things like malaria. Malaria can cause them to lyse the cells quickly. Then things like sickle cell. It's a hereditary condition whereby their blood is such that if they're exposed to a bit of stress, they start to break down their cells. And that's a bit of destruction. So you notice those kind of conditions when, because of the constituents of blood, their eyes can turn yellow and things like that. Depends on where the blood is being broken down. If it's broken down within the vessel, their urine will come dark. They will have this dark, what we call coke-colored urine. But if it's broken down within the spleen or any of the organs that can destroy blood naturally, if it's being broken down at increased rates, then at that point they will start having yellow eyes and things like that. So that's how it is.
Okay, so aside from sickle cell,
Yes.
there was someone I knew that by the time the person had leukemia, acute leukemia, and by the time the first thing they noticed was that the blood was like 13%. Let's talk about that too. Some conditions,
Yes.
aside from sickle cell anemia.
Yes. So acute leukemia is a different ballgame entirely. And what it involves is the fact that in acute leukemia, the cells that are multiplying rapidly, because a leukemia is where something is proliferating or excessively multiplying or rapidly multiplying. In that sense, what happens is it overcrowds, because it's being produced within the bone marrow. It crowds out any other cells in the bone marrow, preventing them from being produced. And because, for example, acute leukemia is white cells that are proliferating, it crowds out all the red cells, prevents the red cells from being produced, and so the patient will definitely become anemic. And the fact that it's also a rapidly proliferating condition, anything that is like that, very metabolic in its production, what it does is it consumes a lot of oxygen, consumes a lot of energy. So it will consume even the blood that is being produced, and that makes it even worse.
Okay, so sometimes, let's describe that as some of the extreme reasons why someone will have anemia.
Exactly.
Let's talk about the signs.
Yes.
I spoke about being dizzy as one of them.
Yes. So the easiest way to approach the signs and symptoms of anemia, we talk about symptoms as what the patient complains about. Signs are what the doctor can elicit from the patient. If a patient has anemia, think of the heart as the one pumping the blood to the rest of the vessels. The heart, unfortunately, is working very well, but doesn't have adequate blood to pump. So it means that the pump is good, the supply line is patent and open to get to the different organs and systems and even the muscles and the tissues of the body that makes you active and energetic and all that. But when the blood is low, it means that very little is getting to those areas. So you start having symptoms. So you are weak, you are easily tired because not enough blood is getting to your muscles. Sometimes you can start passing less urine because not enough blood is getting to your kidneys to produce. You can start feeling headaches because not enough blood is getting to your brain, and you can start feeling dizzy as a result and things like that. So if you imagine any organ and think about the blood supply, if there is a reduction in blood supply to that organ, what happens is that that organ starts to suffer for it. So the ones that need the most, the body does it in such a way that it allows those ones to get just enough so that they are still okay while the others suffer. So the person will really be tired, will really be breathless even when he walks a little bit. You have to take rests. The person might feel dizzy when he stands up and things like that.
That could be early stages, right? Are there symptoms that could tell that this has gone beyond?
So the symptoms depend on how rapid the blood level dropped.
Yeah.
If it drops very rapidly, the symptoms are dramatic. If it drops very gradually, it takes a long time for the patient because it's compensating for it. So it takes a long time for him to start manifesting real symptoms, especially if it doesn't drop too low at the beginning. So a lot of people do not even know they're anemic. They just find out by doing a test.
Because if you say, I'm tired, sometimes you say, because I've overworked myself, that's why I'm tired.
That's what
if you say, I'm breathless, okay, maybe I climbed too many stairs, you understand. But so how do we then know that this is anemia? Let's talk about, the diagnosis.
So if it was just a one-off, you can think, okay, maybe it was, but usually it's persistent, and that should be a red flag. Once you are noticing continuously that I'm always tired, I wake up, I don't feel like, go and check your blood level. Start from there, and then you'll see whether it is. It's a very simple test, very easy, it's not expensive, so at least check your blood level. Then from there we can work.
Okay, so it's just blood check.
Yes, a blood check at the beginning.
PVC?
It's a PCV, HB, but we prefer that you do the full blood count so that if there's any other things, we'll see it in the parameters. That's how it is.
Are there complications that could arise from this?
Yes, definitely. As I said, it supplies the organs. So if there is a long-term or acute, rapid cutoff to any organ, it can cause organ failure and even death. That's how bad it can be sometimes.
Any other one?
Oh, I've just said the extreme, but so many things can occur as a result. So many things. A lot of these patients do not feel like eating. They lose appetite. They can't function very well at work. They can't walk for long distances. They're always feeling dizzy and tired. Some of them can have seizures. You can imagine how disturbing that is to anybody if you're having seizures from anemia. Some of them can have chest pains, and sometimes their heart can even fail because not enough blood is getting to the heart. So they start getting swelling in the lower limbs, the legs. They start, having palpitations. They feel as if their heart is racing very rapidly and things like that. They get short of breath and things like that. So there are lots of things. We can go on, and I won't be able to stop.
And in children, because the WHO had said that anemia, of course, affects more women and children, than... let's talk about anemia in children.
Yes. Okay. I'm not a pediatrician.
I know.
However, I can tell you quite a bit about
I'm sure
it.
you've attended to some children who are
Definitely.
patients.
The main thing, especially in the younger children, the main cause of anemia in younger children is nutrition. A lot of them might not be getting the adequate nutrients. And as I said before, the nutrients you need for blood, B12, folic acid, iron. If you're not getting it in enough supply, a lot of them will be low on blood. For children, especially the younger ones, even the females, a lot of them have not attained to what we call menarche, where they start seeing their period. So we're not even thinking of blood loss in them. We are thinking of is usually nutrition. And for some of them that go to boarding houses and other things where they don't get, the adequate supply. For some of them that are, I know the Gen Z people of nowadays, they like eating all sorts of ice cream and things that don't have those kind of nutrients. Based on that, a lot of them might be anemic. So it might be wise once in a while for the parents to make sure that they check these things, check the blood. There are tests to do to check for these nutrients. If they are deficient, they can now give supplements in that regard.
What's the youngest patient you've had to take care of?
Let's say I see patients, especially for different conditions, from sickle cell to all that. So I see patients as young as 11 months, 10 months, sometimes even 6 months.
Wow.
Yes.
And in that particular child will be sickle cell, right?
Yes, sickle cell patients usually, and I've seen for nutritional anemias, I've seen quite a number that are very young, especially in that age group. When they just come out of breastfeeding, they're not really eating, they're not getting enough nutrients. Okay. Breastfeeding keeps them very well, but after that, what next? So if they don't transition well into eating, that becomes a problem.
Okay, we'll just take a very quick break, and when we come back, Dr. Banjoko will still be here. To stay with us. Welcome back. Doctor, let's talk now about the treatment of anemia.
Okay, so the treatment of anemia will depend on the cause, obviously. So if it's nutritional, then you have to replace nutrients. You have to find out why the patient is not eating or the person is not eating that way and see how. If it's loss of appetite, you might need to find out what's the cause of, is there an underlying illness that could be causing that? Can we deal with that so that we can now get the patient to eat well? If it's a child, you know that you have to work on appetite and things like that. If it's blood loss, for example, a woman who is having her periods and her periods are lasting much longer than they should and it's very heavy, that kind of patient usually will come down with severe anemia after a while. So what you need to do is find out what is causing the bleeding to be so heavy. If it's something that you have to refer the patient to the gynecologist for, you do that. In the time being, there are drugs we can use to suppress bleeding a bit, and then we start the patient on iron once we've confirmed the patient is iron deficient. Those are things we do. For things like B12, sometimes there's a condition whereby it is not that the patient is not taking enough B12, but there's something destroying a part of the body that allows the absorption of B12. As a result of that, we call it pernicious anemia. And as a result of that, the patient cannot absorb the B12 from the intestine. So it's like taking in food that has B12 and everything just goes out through the stool and things like that. So what we do there is we give B12 via an injection, so it avoids that route, and then the patient is fine. So things like that. If it's a leukemia, we treat the leukemia, and then the patient gets better and blood comes back. So it depends on the cause, always depends on the cause for oxygen. But there are things we can do acutely. So if a patient has lost a lot of blood, he might need to get a blood transfusion before we can start working on things to keep him alive, at least till the time we get to what we need to do. If the patient refuses blood, then there are other things. We have people like the Jehovah's Witnesses that don't accept blood. In that case, we might have to give things like erythropoietin, and we find out it's iron deficient, add iron to it, sometimes folic acid if it's necessary, and things like that. So those are nutrients that always boost the blood. So it always depends on the cause.
Okay, and as you always say, doctors and of course people in the medical line, prevention is always better than cure. Let's talk about prevention.
Okay. So how do we prevent it? Knowing the cause of something helps you to know how to prevent it, if you know that. So for things like sickle cell, definitely it's things like, awareness to get people to know what their status is, and then seeing how they can counsel them towards trying to marry the partner that will be conducive for them. Even though there are other things that can be done even afterwards to prevent giving birth to a sickle cell child. But this is not the program for sickle cell. We'll talk about that if need be at another time. But there are other things, nutrition-wise. So people should start eating foods that, contain the proper nutrients, what we call a balanced diet. People should stop just taking cakes and confectionaries, ice cream, and things like that. They should try to eat better. Then for people that bleed a lot from menses and things like that, they might need to, as I said, see the gynecologist, find ways to go around that and sort it out. So basically, if there is any illness, malaria, treated early, rapidly, so that it doesn't cause that. Infections, go to the hospital, get treated, things like that. Once we do that, then it's better. If a patient needs blood and can take blood, he should get blood to be taken.
Because sometimes the complications can be so severe and money consuming, time consuming, and so prevention, as we've outlined, is very, very key. Yeah. Thank you so much, Doctor, for your time.
Thank you for having me.
For all the insights that you've shared with us today on the program. Our guest on the show has been a clinical hematologist with the Lagos State University Teaching Hospital, Dr. Wole Banjoko. Thank you indeed.
Thank you.
And the rainy season appears to be setting in across Nigeria, and the NCDC has sent out an advisory, particularly to some states. Let's check out our news corner for the latest stories.
10 states in Nigeria have been put on alert as residents in the states face an elevated risk of disease outbreak, particularly cholera, following projections of heavy rainfall and flooding by the Federal Ministry of Environment and the Nigerian Meteorological Agency. The states are Adamawa, Enugu, Kaduna, Kogi, Niger, Osun, Oyo, Plateau, Taraba, and Kwara. According to a statement signed by the Director General of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris, the warning comes as the country enters the seasonal window when cholera typically surges. Aside cholera, other public health risks identified include malaria and other mosquito-bird diseases, infection from contaminated floodwaters, drowning, and snake bites. Residents in at-risk areas are strongly advised to boil and chlorinate their water for drinking and cooking. Wash hands frequently with soap and water, especially before eating. Avoid floodwaters as much as possible and maintain proper sanitation. The NCDC also called on community leaders and local authorities in the 10 states to intensify environmental sanitation efforts and encourage early reporting of suspected illness. The Nigeria Center for Disease Control and Prevention said it is working closely with state ministries of health and relevant partners to strengthen surveillance, enhance preparedness, and support rapid response in affected areas. The executive director of the National Primary Healthcare Development Agency, Dr. Muyi Aino, says Nigeria is making steady progress in improving maternal health services despite existing gaps. He made the statement when he represented the Coordinating Minister of Health, Professor Mohammed Pate, during the ministerial press briefing to commemorate the National Safe Motherhood Week 2026. The theme for this year is Closing the Gap from Coverage to Quality Care for Every Mother, with the slogan, Care that Saves, Systems that Deliver. Dr. Aino noted that the event aims to draw attention to strengthen healthcare systems to ensure safe and dignified childbirth for every Nigerian mother, emphasizing that the government has intensified efforts to revitalize primary health care through fully functional facilities equipped with skilled personnel, essential commodities, and 24-hour services. He disclosed that over 19,000 skilled birth attendants have been recruited nationwide, with additional health workers engaged under revamped state programs, amongst others.
The NPHCDA, working with the Federal Ministry of Health and our partners, has supported all of the MAMI locations with MNH, maternal newborn health commodities, 20 different types of commodities, equipment for maternal care, as well as family planning and reproductive health, and over 111,000 mama kits actually have been distributed to mothers to encourage them to come to facilities to deliver.
The World Health Organization has expressed concerns that after 3 years of war, Sudan now accounts for the world's largest humanitarian crisis, with 34 million people needing aid, 21 million lacking health services, and repeated attacks crippling a medical system already weakened by disease and hunger. The WHO, in a statement, acknowledged that while the situation is improving in some states, the health crisis is deepening in areas where fighting continues. Disease outbreaks and malnutrition are rising, while access to health services shrink and funding falls short. Over 4 million people are estimated to be acutely malnourished in 2026, making them vulnerable to medical complications and disease. Disease outbreaks are widespread, with malaria, dengue, measles, polio, hepatitis E, meningitis, and diphtheria reported from several states including Al Jazeera, Darfur, Gedaref, Khartoum, Korodofan, River Nile, and White Nile states. Across Sudan's 18 states, 37% of health facilities remain non-functional. The WHO said in collaboration with partners, it has been supporting the supply chain for essential medicines, medical supplies, and equipment. The health body calls for unrestricted and safe access to all areas of Sudan for the protection of healthcare and for sustained humanitarian and long-term funding.
Are you always feeling tired, dizzy, or feeling lightheaded, having headache, cold hands and feet? It may be anemia. Do visit the nearest health facility around you to have a medical check. A staging time saves 9. That's Health Matters for this week. Thank you so much for staying with us. Do keep it locked on Channels Television. I'm Yomi Otaigbe.